Go.
Okay, good morning. We're going to do oxygen therapy. So if you get your oxygen skill sheet, this is the oxygen nasal cannula. You're going to bring the necessary equipment to the bedside, perform hand hygiene, put on PPE, identify patient name, date of birth, close the curtain or the door for privacy. Then you're going to explain what you're doing, the reason for doing it, putting a no smoking sign because oxygen is a gas, it's flammable. And then you want to connect your nasal cannula. So this is a nasal cannula. It also comes with extra tubing. So what you'll see is the nose prongs. I'm just going to take off my mask to demonstrate. Those nasal prongs are going to go up like this, and then just like that. And you can adjust them. So you want to have them go in the nose, over through, and adjust to be comfortable to the patient. Then what you're going to do is you're going to hook it up. This will be on the wall. It's a concentrator with a concentrator adapter, or sometimes they're called Christmas trees. But then you would hook it up to this or your connector set, and then you would move the green dial for the dosage amount of oxygen. So this particular one goes up to 15 liters. We wouldn't do that with a nasal cannula, but we would do it with other ones. But you could go up to 4 or 5 liters with your nasal cannula. Okay. Then it says, connect the nasal cannula to oxygen setup with humidification if you need humidification. Adjust the flow rate. This is how you're going to adjust the flow rate. Check oxygen in the prongs. So you want to check, you can feel the oxygen coming out. Place the prongs in the patient's nostril, place the tubing over behind the ears, and then we're going to alternate this little tube here to kind of go up and down for comfort. Encourage the patient to breathe through their nose with their mouth closed, and reassess the patient's respiratory status, rate, effort, lung sounds, pulse ox. Remove your PPE, perform hand hygiene, put on gloves to remove any of the cannula, and assess the nares for any breakdown and behind the ears for breakdown. So now that is your skill for oxygen. Now you're going to have oxygen face mask skill. And these are the different types of face masks. So this is probably a face mask for ambu bag. Go right over your nose and mouth. There's different sizes, and then it hooks up to oxygen. This would be trach. It would go over and onto a patient's trach, okay, if they had an artificial airway. This is a non-rebreather with a bag. Okay, so again, we'll do the same thing over the patient's head. It has a pin to its nose. This is a nebulizer treatment set up. So this would be the nebulizer treatment. Most usually you would see it set up like this, and then the patient would put it in their mouth. Steam would come out this way, and the medication would be put in here. But you can also set it up to a mask in case they can't do the actual mouthpiece. So what you would do for this is you'd have like a little crappy jet, it's much smaller than this one. You'd twist it off, put the medication in, then close it up, and hook it up to one of these aerators, or if you're in a hospital setting, you would hook it up to your tree, just like that. And then you'd put the oxygen way up and you'd see smoke coming out, okay? So you could do it this setup, or you could do it with this setup, okay? And this is like somebody going home with it. And then they would just turn it on. Again, you would have it coming out this way, and you would just have them cover the mouthpiece with their whole mouth, have a seal, and then just breathe in and out. Then we have Venturi, thank you, Venturi masks. Venturi masks have kind of like this, but then you can add, you can add the different pieces here. So these pieces come in all different colors. Thank you. And each one, if you look on the tip here, it says the percentage of oxygen and how many liters is needed. So this particular one is 35% and 8 liters? Okay, and then we have 31% 6 liters. We have 28% and 4 liters. So that's how much oxygen is being delivered and what you would set the adapter to. So you would just set it to 4, 6, 7, depending on the piece. And that would be a doctor's order or a protocol that you're following. Okay, and then we also have talked in class about incentive spirometers. So this is an incentive spirometer. And we would obviously pull this out a little bit. And so you set the patient's goal to the smiley face. And then maybe you would set them to try to come up to 1500. When they take a deep breath in, this yellow piece will come up and this will also come up. So if they're taking a strong enough, consistent breath in, then it'll stay here and then this will rise, just exercising the lungs. So post-operatively is a big time, or if they're in bed staffing. All right, so your face mask says you bring the necessary equipment to the bedside, stand over the bed table, perform hand hygiene, identify patient name and date of birth, close the curtain, explain what you're doing, no smoking because we're still using oxygen, attach the face mask with humidification if ordered, start the flow rate, so that would be here. Okay, so first we put the mask on over the patient's mouth, make sure it fits snug, put this over, and then we will hook up the oxygen. Position the face mask over the nose and mouth, adjust the elastic straps to fit snugly. Patient reports irritation, redness, we can put a little gauze pad underneath. Reassess the patient's respiratory status, respiratory rate, lung sounds, remove PPE, remove the mask, and dry the skin every 2 to 3 hours. If the oxygen's continuously running, you might have some condensation and moisture on the face. So we do not want to put powder, but maybe some gauze pads. Okay, so that is oxygen.